So, question here, mini podcast on alopecia areata. What do you do about it? What causes it? Well, this is a question that's near and dear to my heart. My eldest daughter actually suffers from alopecia areata. And many patients who have alopecia areata, it's going to be a multifactorial effect. This is, for some reason, an autoimmune condition where the body can kind of somewhat attack your own hair, and it creates these patches. These are classic signs when you can see this with a trichoscopy on how the hair looks. Classic signs when you look at someone's head. There's different versions of alopecia areata. Thankfully, my daughter's alopecia areata are these patches that come and go. She does not have complete alopecia areata, which is super stressful for patients, or total alopecia areata, or universal alopecia areata, which can include the eyebrows on some patients. But that being said, it's stressful nonetheless. And what brings on alopecia areata is different for every patient, but it seems to be stress. Whenever anyone has an autoimmune response, there's different ways to kind of treat that. The classic way is to turn off your immune system a bit. And the way I like to do that is with steroids of some effect. For most of our patients, that means an injection of Kenalog or steroid of some sort into that area to turn off that immune response. Now you have to be careful with steroid injections anywhere on the face or body because they can create little ligature dents. But when properly administered, this seems to be the best treatment for most patients. I'm not a big fan of oral medications for patients who do this because, again, it's going to have systemic side effects with steroids and taking long-term steroids. And why not just do a topical or injection in that area? And then I think the other thing that it seems to be helpful for patients with alopecia areata is practicing mindfulness and stress relieving strategies, because it does seem to be triggered by stress, but not always. Practice a healthy diet, because again, when the body's sensing stress, whether it's mental, physical, or of any other type, it may manifest itself externally with those patches of hair loss. Hopefully that's helpful for those patients. We do see quite a bit of patients with alopecia areata, and for most of them, it's a simple injection and they're kind of on their way. And it's often a little lecture like this about what to do to manage some of the other factors in hair loss.